Hello, excuse me. I'm Dr. John Cruz, author of Recognizing Adult ADHD, and today I'm going to be talking about positive illusory bias in the setting of ADHD. I'll be talking for less than 20 minutes. If you have questions while I'm talking, please write them in. This will be posted on both Facebook and YouTube after the session. So I'm going to launch right into it with what is positive illusory bias. So this is a phenomenon that's been studied for about 20 years in ADHD. Actually, a majority of kids with ADHD seem to display this, and it's breaking down the words positive. So these children have an overly positive, overly exaggerated sense of their own abilities or performance. It's illusory, and that means fake or false, and by that measurably, these kids are overestimating their true talents or abilities, and this is studied in both academic performance subjects and in social competency measures. And it's a bias in terms of, it's a persistent trend. It's not just in one narrow area or one narrow report. I brought up positive illusory bias last week when I was talking about emotional volatility and emotional dysregulation and rejection-sensitive dysphoria. So one interesting thing to note, even though probably a majority of children with ADHD express at least some PIB or positive illusory bias, that doesn't mean their own feeling states are always positive, or that their feeling states may not match their cognitive assessment of their own abilities. So, so I'll go into that later as it comes up. So a few things to frame this discussion in that a moderately or mildly positive illusory bias is actually considered the normal state, at least in Western societies. And there's an interesting book that came out earlier this year called Studying Weird People, and I'm blanking even on the what the weird stands for, but essentially Western white cultures have been the ones primarily studied for a whole host of psychological phenomena and what we consider normal. So it's not clear how applicable this is to the rest of the world. I'm not saying it isn't, I'm just saying we haven't demonstrated that. But in Western societies, Western white societies, where we've been looking at self-assessments, optimism, performance, mood, and people, most people at least slightly overestimate their own abilities in social situations and academic situations and physical performance situations. And that is sort of the normal baseline. And one of the more consistent findings in psychology, psychiatry is that people who are depressed tend to have a less positive assessment of themselves. But rather than the depressed people being wrong or inaccurate, it's that the depressed people are the ones who have the most close alignment between their own assessment and their own performance. So there is at least in Western societies and the way it's studied, a prevailing mild positive illusory bias, but in kids with ADHD, the magnitude of this is higher. So they are exaggerating to a greater extent their own abilities. And again, while I'm not saying that every kid with ADD has this, when you look at just groups of kids selected for ADD versus non-ADD kids, the prevalence of PIB, positive illusory bias, is substantial, is large enough and extensive enough that it affects the whole group rating. So you can make bland generalizations that kids with ADHD are more likely to misperceive their own ability and misperceive it in a hyper-positive direction. So the next interesting thing about positive illusory, so when I'm talking about positive illusory bias, I'm not going to be talking about its mild form across society. I'm talking about it in its more exaggerated form that's seen in children with ADHD. So the next interesting thing that sort of differentiates positive illusory bias from sort of mild optimism is that mild optimism or general positive self-esteem actually measurably in laboratory situations and in some attempts at studying it in real life. If you have a high opinion of your own ability, one, that increases your own motivation to take on more difficult tasks. Two, it increases the likelihood you persist or push through. I mean, if you think you're smarter than everyone else and everyone's stymied by the first math question on the test, you are more likely to push through and keep going and working at it because you believe yourself to be powerfully successful. So this is, again, normal optimism. And your actual performance improves in the normal world if you have mild optimism. However, in kids who are studied in the lab situation with positive illusory bias, kids with ADHD, having these overinflated estimates of themselves does not increase their motivation to perform difficult tasks. It does not improve or enhance their persistence on a task. They give up more easily. I mean, giving up more easily is a component of ADHD, but it isn't rectified or erased by the PIB. And their performance isn't enhanced through working harder, working longer, or thinking that they are better. And then the third and most striking piece of information about positive illusory bias is that in general, and this is a generalization, usually people have overinflated ideas of themselves if they're given feedback that, you think you're the best math student in the room and you just scored a D on the test when most of the other kids were getting A's and B's. That negative feedback, usually most kids and adults can incorporate into their self-image, and they revise themselves and don't rate themselves as highly. Again, both apparently in the real world and in laboratory situations, negative feedback does not seem to have a strong effect on revising kids with ADHD's overinflated view of themselves and their own performance. So again, that is how we define positive illusory bias. And if I summarize it again, so grossly overestimating your own competency and performance ability, that this enhanced view of yourself does not make you work harder, does not make you work longer, does not make you perform better, and that given negative feedback does not revise your evaluation of yourself. I would argue that almost anyone I describe those things to right away starts thinking, isn't there a certain precedent that meets all of those traits? So one of my contentions is that, and I'll be delving into this in the next few minutes, that a large part of what we call narcissism in Mr. Donald Trump may well be more a manifestation of positive illusory bias. And as I'll get to, you may have both. One may predispose you to the other. But narcissism assumes that these performances are all tied into a need to make yourself feel inflated or bigger, and there are other possible explanations for PIB in the setting of ADHD. So a few other words, although this has been studied most widely in boys and in girls, there are at least some suggestive findings that many girls with ADHD also do display some of these PIB tendencies or would qualify for having PIB. In terms of subsets or forms of ADHD, again, and there's not completely consistent data, but my summary of the data would suggest that the strongest correlation for positive illusory bias is with hyperactive impulsive forms of ADHD, and maybe slightly less so with inattentive ADHD. Again, given that the hyperactive impulsive type is overrepresented in boys and the inattentive type is overrepresented in girls, that may explain why we might see more PIB in boys with ADHD. So jumping into where the research is into what is the source of PIB, where is it coming from, what does it mean? There's sort of 4 theories that have been put forth through so far, and they are not mutually exclusive. So the 4 forms, one is that we know in terms of some other aspects of cognitive development, kids with ADHD are immature or delayed in their maturity or growth. There's even strong evidence for that on the neuroanatomical brain structure and brain connectivity level. And we also know, again, as I said, humans, at least weird humans, overestimate their abilities. Kids certainly overestimate their abilities more than adults do, and there's some decrease over time. Maybe kids with ADHD are just lagging behind at getting more realistic assessments because in general the whole brain is less mature. They're a few years behind in development. That's one theory with a little data behind it. The next theory is that some of the very executive function deficits, the neuropsychological problems that underlie ADHD, I mean, particularly the ability to monitor yourself and what you're doing, the ability to be self-aware, are some of the very tools you'd think you would need to come up with a self-assessment that's an accurate self-assessment. So there's a body of research that argues that much of that we would expect or anticipate PIB to be there in kids with ADHD exactly because their skills in assessing themselves in the world are problematic or have deficits in them, and that's coming to the fore in their own assessment of their own ability. A slightly different version or a separate line of thought is that PIB is a source or is caused by ignorance of incompetence. So it's more that kids with ADHD are sort of so inattentive to particularly social interactions and rules and skills, and maybe, inattentive to what the teacher's expecting or learning, that it's not so much that they're not clued into their own performance, it's that they're not even clued into what the task is or what other people are measuring or assessing or what is considered a good effective social interaction or a good performance on a academic test. And then the fourth theory is that rather than being sort of a neurobiological phenomena, that there's a more psychological reason for PIB, and that it's a self-protective effect, that if you know or you've experienced, and knowing doesn't mean at necessarily a conscious level, but if you are and the data delivered to you that you are failing more often on social interactions, you're making fewer friends, your friends are breaking up with you, causing more conflict with you than it seems other kids around you, you're performing less well on academic tests, then you're going to have a tendency towards developing a negative self-view of yourself, and I know that's redundant, sorry, that a self-protective measure is that you develop a inflated sense of yourself to protect yourself from feeling bad. Now that's getting pretty close to what many people posit as some of the cores of narcissism. So narcissism is roughly defined as people who have an impaired or negative thoughts or feelings about themselves, and to compensate for that, to not feel bad about that, they overinflate, they overvalue, they overattribute good traits to themselves and posit those negative traits, those deficiencies, onto other people around them, so they devalue others. So a few of the things we know is that among adults who wind up diagnosed with narcissistic personality disorder, if you go back to childhood history, ADHD is overrepresented. It's not that everyone with narcissism was an ADD child. It's not that a one-to-one correlation. And it's not that every child with ADHD develops into a narcissist, but they do seem to be an overrepresentation. And I think since most of the rest, we don't have a lot of hard data on that, I'm just going to leave that there, is that we need to do more work on, are the kids who have strong cases of PIB as part of their ADHD when they're young developing into the narcissists? So one other line of evidence and tying back more to the dysphoric reaction sensitivity that I talked about last week. One of the things we know is that kids who are both have ADHD and are depressed in childhood actually do have lower rates of PID and are less likely to exaggerate their own abilities. And sort of what that would be saying is if there's an overall push or a tendency of ADHD in kids to make them over exaggerate their abilities, we know again the push in depression is to downgrade your own assessment of yourself. And if you have both conditions together, it seems like in terms of your own self-esteem, self-assessment, that the depression is the one that wins. So that's about all I'll have to say today. I think next week's topic is going to be about accommodations in work or school and ADHD. So have a good week, stay healthy and happy. There's one question there, and it's asking about the Dunning-Kruger effect. Is that the adult version? And my simple answer is I don't know enough about the Dunning-Kruger effect to give you an answer, so I will do my research and try to find the answer to that. If there's any other questions, I can try to address them right now. If not, again, you can post questions later, either on the Facebook page or on the YouTube channel. Again, have a healthy, happy week, and that's all for now.